Welcome to Quick Medical Review. Today, pyelonephritis in under 5 minutes. Let's go. Buzzwords first. Fever plus flank pain plus CVA tenderness, the classic triad. E. coli, the most common cause. Urine culture, the diagnostic test. Outpatient fluoroquinolone. Inpatient intravenous ceftriaxone. Complicated obstruction, abscess, pregnancy. Let's break it down. Pyelonephritis, infection of the renal parenchyma and collecting system, usually an ascending infection from the lower urinary tract. Organisms E. coli is the most common, about 80% of cases. Other gram-negatives, Klebsiella, Proteus, Enterobacter. Proteus is associated with struvite stones, staghorn calculi, Enterococcus. Staph saprophyticus, second most common in young sexually active women but more associated with cystitis. Risk factors: female sex, short urethra, urinary obstruction, stones, BPH, pregnancy, vesicoretral reflux especially in children, catheterization, diabetes, immunosuppression. Presentation: fever, often high, chills, rigors, flank pain unilateral, costovertebral angle tenderness on exam, nausea and vomiting. Lower urinary symptoms may also be present: dysuria, frequency, urgency. Workup: urinalysis, pyuria, white blood cells in urine, bacteriuria, possible white blood cell casts, which are pathognomonic for pyelonephritis, distinguishing it from lower UTI. Urine culture, the gold standard, identifies the organism and sensitivities. Blood cultures if sepsis suspected. CBC leukocytosis. CT abdomen if complicated pyelonephritis, suspected abscess, obstruction. Treatment: uncomplicated outpatient management. Oral fluoroquinolone, ciprofloxacin or levofloxacin for 7 days, or trimethoprim sulfamethoxazole for 14 days if susceptibility confirmed. Complicated or requiring admission, intravenous antibiotics. Ceftriaxone first line, or fluoroquinolone intravenous, or ampicillin plus gentamicin. Switch to oral antibiotics when clinically improved afebrile for 24 to 48 hours. Total duration 10 to 14 days. Indications for hospitalization: inability to tolerate oral medications, sepsis, pregnancy, urinary obstruction, immunocompromised, failure of outpatient therapy. Pyelonephritis in pregnancy, always treat as complicated, risk of preterm labor and sepsis. Admit for intravenous antibiotics, ceftriaxone. Avoid fluoroquinolones and trimethoprim sulfamethoxazole in pregnancy. Complications: perinephric abscess, suspect if fever persists despite 48 to 72 hours of appropriate antibiotics. CT for diagnosis. Percutaneous drainage plus antibiotics. Emphysematous pyelonephritis, gas-forming infection seen in diabetics. CT shows gas in the renal parenchyma, high mortality, may require nephrectomy. Sepsis. Chronic pyelonephritis, repeated infections causing renal scarring and chronic kidney disease. Exam: pearl fever plus flank pain plus CVA tenderness equals pyelonephritis. E. coli is number 1. White blood cell casts are pathognomonic. Outpatient fluoroquinolone 7 days. Hospitalize if pregnant, septic, or obstructed. Persistent fever after 48 hours, think abscess. That was pyelonephritis on Quick Medical Review. Study smart, not hard.